Hello, folks. My name is Jason Oko. I am the Data and Preparedness Coordinator for Maine Emergency Medical Services. In this video, we're going to be discussing CQI, our upcoming newsletter, and how this newsletter can be relevant to your CQI queries. So first off, let us explain what CQI is. CQI is continuous quality improvement, and within MEFRS, it's a set of modules and features which will allow you to review EMS incidents within MEFRS. With CQI, you have greater control and transparency during the review process. The CQI reviewer lists include questions for the reviewer to answer, and only reviewers assigned to specific categories can conduct that review. The review list uses criteria to display the incidents you require for that reviewer. A breakdown of what CQI has to offer is a series of questions which you can write yourself, or you can choose from a list of questions that Maine EMS has already written and associate them with your category. CQI forms, which is how you would like the data to be displayed for you. It's very similar to a print form, just selecting what data elements that the clinician's documented that you'd like to be seen on the form. CQI categories, this is where you can establish the criteria for your review, and you put everything together within a category. You put your questions together, your form together, and your reviewers. Users are assigned users in your agency as incident reviewers through the employment tab on their account. So if you navigate to a user and enter their employment tab, you'll say CQI reviewer is equal to yes. And then CQI and review statuses lets you update the CQI status of an incident to reviewed or needs crew attention, so on and so forth. This is a map of the big picture of CQI. It's a good reference for the cycle of a patient care report through the CQI process, starting with your users, your questions, and your forms, and then going into categories, into a CQI list, which is an incident list, reviewing the incidents, answering the questions, updating the status, seeing how it conforms with any rules, which we're not talking about CQI rules in this video, but we can at a later date, and then communicating with your crew and receiving feedback from your crew. This is a small list right here. We'll pause right here for a few seconds so you can take note of the process to learn more about CQI and how to query your CQI data as it pertains specifically to this report. So to navigate to CQI, you're going to click where it says incidents in the app panel and drop down and say switch to CQI, and you'll see that the screen will flip there, and now you have access to your CQI review categories. Here's the switch to CQI button, just not flipping, and so you could see it right there. And then once you click on switch to CQI, you'll go ahead and click on CQI, and then you'll have the list of reviews that your reviewers can access. This is individual to each CQI reviewer. Reviewers access incidents requiring review through the CQI reviews list in the app menu. The reviewer can only access the CQI review lists in the menu to which they are assigned to. Upon opening an incident for review, reviewers use the incident data to answer their review questions and leave comments as necessary. If comments aren't turned on for the agency, clinicians can view the question, answer, and comments left by the reviewer. Clinicians can reply to the reviewer and make any corrections as needed from within the patient care report in MEFRS. This process creates a closed loop of information from the reviewer back to the clinician. Upon completing a review, reviewers can update the reviewer status to whichever status is appropriate. So within the review, you'll notice that the default look back when you open one is set to the last 2 weeks. You can edit this by clicking on the menu little icon there, or by typing in those boxes. You can clear the date range by clicking the X. The little pin button on the right there, that will allow you to drop down the filters and pin them there so that they're not covering up any incidents. And you notice we have a couple of filters in here: patient disposition, crew member, and the agency name. Agency name is important because if you're a reviewer that works at multiple agencies, like a lot of EMS clinicians do, you'll want to narrow this down to just the agency that you're doing the review for. So what do we ask in these reviews? We have a series of questions that we've developed to ask during these reviews. The first question is, does the documentation indicate if the dispatcher provided instructions for naloxone administration? This is one of the many capabilities that our dispatchers can perform for us. And so we ask that question. If you are conducting a review and to answer this question, the answers are yes, no, unable to determine. One of the options for determining it will be the role type of person administering the medication. If that says patient layperson per EMD instruction, that would indicate a yes answer there for that review. The next question we ask is, if naloxone was administered, does the documentation indicate oxygenation and ventilation prior to the administration of naloxone? Please recall, per the Maine EMS protocol, yellow number 1, the main goal for these patients is managing the airway. So oxygenation and ventilation come before the administration of naloxone. The next question is, if naloxone was administered, was there a suspected opioid overdose documented and a respiratory rate of less than 12 breaths per minute documented? Yellow number 1, which is the poisoning overdose protocol for naloxone administration, indicates for a suspected opioid overdose and when the patient is having respirations of less than 12 breaths per minute to administer naloxone. If naloxone was administered, does the documentation indicate the dosing of naloxone was titrated to achieve adequate respiratory drive and airway protection rather than a completely awakened state? Remember, the goal is to reverse their lack of respiratory drive and not bring them to a completely awakened state. This is why the dosing is 0.5 milligrams of naloxone titrate to respiratory drive. For EMTs, for advanced EMTs and paramedics, it's 0.1 milligrams to 2 milligrams IV titrated to a respiratory drive as well. The next question is if a suspected opioid overdose and the patient refused transport, did the clinician document a procedure, a leave behind naloxone education with the patient, a friend, or a family member? Next question, if this is a patient refusal, does the documentation indicate a complete and informed refusal conversation? For your consideration, or complete and informed refusal conversation for an overdose reversal could very well be, we do not know how long the medication that we administer to you will last in comparison to the medications that you may have taken. The half-life of naloxone is 60 to 90 minutes, and it is very similar to that of heroin, and fentanyl's half-life is nearly 4 hours. So in the review category, this is how it will appear to you. You have an incident status and a reviewer status, and they are separate. I recommend never touching the incident status in CQI review because this may be related to billing purposes for your agency. But the reviewer status can be changed based on your answers to the questions. The questions are on the left, and the data that you will use to answer the questions are on the right. There is a save button here. After you've answered all of the questions for the incident and updated the reviewer status, please click the save button. You can send a message directly to the crew right from the CQI module, and you can review any attachments or addendums in the incident history. This is an indication that the incident is unlocked. The hasp on the lock would be closed if it is locked. And the button that has the one /1, that indicates you can navigate to multiple incidents right here. And the back button will bring you back to the CQI incident list. When you're answering the questions, in this example, if naloxone was administered, does the documentation indicate the dosing of naloxone was titrated to achieve adequate respiratory drive and airway protection rather than a completely awakened state? We've answered no, because the medication dosage was 2 milligrams intranasal, and that is outside the initial dosing parameter for an initial dose of naloxone. And so we left a note, please review the Maine EMS pre-hospital treatment protocols for the appropriate intranasal dose of naloxone. And with that in mind, we also want to keep in mind that CQI is designed to lift clinicians up. So if the naloxone was administered, does the documentation indicate oxygenation and ventilation prior to the administration? And we see that they documented that they were assisting ventilations with the BVM, and it was successful and the patient's condition improved. So we left a note of good job, keep up the good work. We've answered all of the questions now. We've updated the reviewer status to completed, and then we've clicked save. So now we've answered all those questions and we've done a bunch of reviews. We want to be able to see, how does this play out for our agency? Because you could have the back and forth between the crew and you can show that, and that's going to give good feedback to your crew. However, at some point, maybe you'd like to see all of the data for all of those questions you answered. And that's where Report Writer will come in handy. And we've built a query for this. It is called the Substance Use Disorder CQI query. And this query will provide all of the responses to all of the questions that we asked in the query. Does the documentation indicate dispatch administration of naloxone? And so on and so forth, all of the questions. And we've added a few other fields, the incident year and the incident month. The PCR number is a link to the PDF of the actual incident. And we've added the primary impression, secondary impression list, and a few other fields that can be of use. Data managers or CQI coordinators for EMS agencies or agency administrators, they can feel free to come in here and take this report and navigate to it, open it up and edit the report as they see fit, and then save it as their own report for their own agency. If you wanted to get this data out of the report writer into something that you could provide some analysis to, you would export it and you would click the actions button and then select export, and then export it to either a PDF, a CSV, or a Word document. A CSV is an Excel spreadsheet. There's a comma separated value. And last but not least, thank you for watching. If you have any questions, please do not hesitate to reach out to Maine EMS. Thank you and have a great day.